The risk analysis process starts with defining the intended use and all reasonably foreseeable misuses of your device. The intended use is defined by the manufacturer and should mention all relevant aspects of the use. We use a standard set of 6: the intended purpose, uses, patients and indications, use process, involved equipment, and the intended environment. But what are these? Well, let's briefly see what these are by using a common medical device as a case: a syringe pump or infusion pump. Just in case you never used one, we'll explain. Imagine you have a patient who broke their leg and needs morphine against the pain after having had surgery. The doctor decides that the patient needs 8 milligrams of morphine per hour. Obviously, you can't put a nurse next to the patient to very slowly squeeze the syringe all day, so that's where the syringe pump comes in. You can put a syringe filled with medicine in it. Then, using the user interface of the device, you set the device to press the syringe with a certain speed depending on the desired dose and the solution concentration of the medication, so that the patient gets the right amount of medication at the right speed. Basically, it's just a motor pushing the syringe at a speed selected by the user. Now, as a manufacturer, this is what we could state as a device's intended purpose: to reliably and accurately deliver medication and small quantities of fluids to a patient continuously via an intravenous line, which is the tube connected to the needle in the patient's arm. The intended users would be clinical personnel trained and licensed to administer drugs to patients, like doctors or nurses. The intended patients and indications could in this case be very broad: anyone in need of getting medication or small flows of fluids administered. But because many drug doses are weight dependent for very lightweight patients, the infusion speed would have to be extremely low, but still very accurate. That would be technologically very difficult without making a very expensive pump. So the manufacturer decided that our pump is only intended for patients of at least 4 years old and weighing no less than 10 kilograms. For the intended use process, it is good practice to make a table like this, in which you describe each step in the entire process of use for your device, from the moment it is received by your customer until the moment of discarding or recycling the device. For each step, choose a number and a description and describe what should be done and, very importantly, by whom and to whom. Because in the life cycle of the device, there may be more people who should be able to safely handle or otherwise come in contact with the device than only the core user who applies it for its intended purpose. Now, when looking at involved equipment, there are quite some things that we should keep in mind. First of all, the syringe. Will you design your pump such that it can handle any kind of syringe of any size, or will you make your pump simple and such that only one specific brand, like your own, fits? Choices like these will on one hand determine how much money you can make if someone buys your device and has to buy your syringes too. But making your pump syringe specific will also keep away buyers who want to use your pump but prefer to use other syringes. Other involved equipment next to the syringe will be the infusion lines, which are silicone tubes connected to the syringe, and injection needles at the end of the line. And the pump itself may need to be hung down a bedboard or a trolley. Now, the intended environment may be easily forgotten or considered obvious, but it should be carefully defined for your device. In a regular hospital, the device is quite safe, but even there you should design it such that it does not disturb or get disturbed by other equipment. And if you intend it to be used, for example, also in a battlefield hospital, how will you design it to withstand the extremely high or low temperatures, dust, and maybe the occasional splatter, and still function? That requires a very robust and hence more expensive design. Well, if you state that it is for indoor use at a standard room temperature only, the device can be cheaper while still fitting maybe 99% of all use cases. But you will have to let the user know what your device can handle, like in a user manual or on a sticker on the device. Speaking about rules regarding your device, there's another reason why you want to carefully describe what the device is intended for, and that is because it defines whether your device actually is a medical device and has to comply with the MDR. And if it is, what kind of class it should be treated as. Now, if there is an intended way of doing things, there will always be people using the device in a non-intended way. which we call misuse. This can be on purpose, like when using a construction hammer to hit someone, or accidentally, like when losing grip and dropping a hammer on someone's foot. That is why the MDR requires that you also carefully think of any kind of reasonably foreseeable misuse. After that, you must determine and minimize the risk of such misuse happening, preferably even by designing your device so intrinsically safe that such misuse is almost impossible. Like how car manufacturers and fuel stations ensured you cannot accidentally put diesel in a car running on petrol because they made the diesel fuel nozzle bigger, so it doesn't fit the smaller opening of a petrol tank. Of course, the term reasonably foreseeable is a bit vague and open to interpretation. What is still reasonable, and to what extent should you consider a not very smart action by the user foreseeable? Unfortunately, there is no clear answer to that. But there are three basics that help getting to a proper risk analysis. First of all, be thorough, better safe than sorry. And to make sure you don't miss anything obvious, work with a multidisciplinary team. Combining diverse views in this process is very important because people tend to look at a problem from the viewpoint of their own experience. A mechanical engineer will most likely come up with more mechanical risks, while an electrical engineer will probably be the first to point out any electronic risks in your device. And lastly, there are various standard methods for doing a risk analysis in a structured way. One such method is to apply our forensic engineering approach, which you can learn about in our other edX MOOC, to prospectively and systematically check everything that could go wrong with your device anywhere in its life cycle. For each of the aspects of the intended use of your device, you could come up with related misuses. There are three different types of misuse. The first type of misuse is related to use errors, when someone unintentionally does something wrong while intending the right thing or thinking they did the right thing. Second type are intentional acts of misuse, like hitting someone with a construction hammer. And the third is off-label use, which is the intentional but usually well-meant use of the medical device for other applications than intended by the manufacturer. Off-label use does not necessarily have to be unsafe or cause problems, but because the manufacturer did not intend and possibly did not design the device to be used for that purpose, it may be unsafe. And no matter whether the off-label use is unsafe or not, when the device fails or accidents happen with the device during off-label use, it is likely that the user themselves are accountable for any negative consequences, not the manufacturer, and any warranty will definitely be expired. Now let's find one misuse for each of the shown aspects in the intended use for a syringe pump. A user could use our pump for another purpose than it was meant for, like for pumping large volumes of liquid food into a patient's stomach when they are in a coma. That's not what our pump is meant for, because liquid food has a higher viscosity, which requires a stronger pump to properly propel the syringe. Still doing this could damage the pump or cause the liquid food to come out too slow, which could eventually starve the patient. The intended users were doctors and nurses. So one foreseeable misuse would be that a doctor gives a pump to an untrained patient to take it home so they can self-medicate. And much could go wrong. Now, the pump is not meant for patients less than 4 years old and lighter than 10 kilograms. So applying the pump to a newborn would clearly be a form of misuse. Off-label use, to be specific. Most misuses will be in the process of use. The nurse could start the pump while forgetting to first remove the closure from the infusion line, a typical case of a use error. Or one could abuse the pump to crack a walnut for lunch, which would be intentional misuse. Or the nurse could be listening to music and not hear the alarm the pump gives when the syringe is empty. All of these are process-related misuses. Now, misuse related to the involved equipment can, for example, easily occur when it's unclear how strict the manufacturer's instructions are about the types of syringes that may be used in the pump. Imagine there's a company selling a syringe named SuperSafe 500 that you cannot squeeze manually, but only with a special super strong pump. If the nurse would put that syringe in our pump, the pump would not be able to squeeze the syringe and the patient would not receive any medication. Because our pump will usually be in the hospital or another healthcare setting, the intended environment may seem unlikely to be the aspect of misuse. However, these pumps also have a battery to bridge any power gaps and for situations when a patient has to be moved to another room or to surgery, because then the pumps will be moved along and must stay working. That's why they are designed to be mobile. But if a patient on medication is recovering well enough to take a walk outside with the infusion pump connected, this pump may have some harsh temperatures or splashes coming. And depending on why this was done, this was an error or off-label use. Now, to wrap up, we have seen the different aspects of a medical device's intended use and how to describe its intended use process in the handy table. And we also discussed the 3 types of reasonably foreseeable misuse, including off-label use.